Welcome to the Cheer Athlete. On this episode, we're going to talk about when it's important for you to, or not just important, but when it's necessary for you to seek medical treatment. And I see this a lot on social media. It's very easy to ask our friends on social media, my kid's been having pain. Should we do? What have you done? Because we want to get that feedback and we want information from other people. But remember, it's social media, and we're not all qualified professionals to be able to make that judgment. We're not there in the situation. So listen in because I've got 5 tips for you for when you absolutely need to put down social media and go see a physician or sometimes a physical therapist. Welcome to the Cheer Athlete Podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. All right, let's dive in because that's the importance of this episode. When is it okay for your kid to keep cheering? When can you expect them to return when they have an injury? Or when do you need to take them to the doctor? Or when is it okay for you to ask on social media? So first and foremost, if someone, the cheerleader has a catastrophic injury. Now, we're going to talk catastrophic injuries that are not life-threatening. If someone is suspected that if they had a fall from a height and they can't move their arms and their legs, that's a 911 call. We don't see that often, and touch wood, let's not see any more of those. So we'll talk catastrophic, like they have a mild head injury, which is a concussion, which can lead to bigger issues. Now, signs of a concussion or signs that they might have suffered a concussion when they come down out of a stunt, when something happens, they lose consciousness. So if there's been a collision, if they hit the ground, if they headbutt and they black out, even for just 1 second, they need to go to the emergency room. Likely they're going to get sent home. And yes, it's a pain, but that makes sure that nothing else is going on. They then will likely get followed up with their primary care and or orthopedics for further assessment and evaluation. And there's certain criteria that they have to go through to return to sport and to be able to participate. When we don't follow this protocol, that's when the issues happen. They end up with further risk for another concussion. Maybe they end up with just dizziness. They don't do well in school. They end up with personality changes. And all of this can happen when we don't fully recover from a concussion. So if it's suspected that you have a concussion, if you've had a loss of consciousness, you need to go. If they come down out of that stunt and they bump their head and there's no headache, they don't lose consciousness, they sit for a minute and maybe things are a little sore, but they're not really, they're fine. They're not confused. They know where they're at. They know exactly what happened. And a little sore, you might sit them out for that game or that event, practice, competition. They probably, if they're in the competition, they're going to get back in. But if they're at practice, maybe you sit them out, let them kind of settle down, and then they probably can proceed. But if they've got a headache, if they've lost consciousness, if they're confused in any way and they don't know where they're at, they don't know their date, that's all signs that something's up and they've had some sort of brain injury and they need to go get checked out. Emergency room first and then primary care. All right, number 2, if something happens, they come down, they have an injury, and they have pain and they can't walk on their legs, So if they come down, they roll their ankle and they can't walk on it, that's important to take them to get x-rays. That's the number one. There are predictive rules out there as far as injuries go. And if they can't walk on it, then so they had an event that potentially could be a fracture and then they can't walk on it. Those are 2 types of things that, we want to get those checked out to make sure there isn't a fracture. There could be instability, there could be ligaments, but if they can't walk on it and something's going on, and having that workup will be important for them so that they get the healing right away. So if they're a practice or a game or out in life, you step off a curb wrong. As I see this in the clinic with older people all the time, like you step off a curb wrong and like you go down and then you can't put weight on that limb. That's something that they need to go get checked out and have x-rays and get that evaluated. If it's, they it hurts, and you see this in football players all the time. I think it was Patrick Mahomes went down, he got hit, and his grip in his knee was really uncomfortable. And when he got up, he was able to weight bear on it, but you could tell he was really wobbly. Um, and that really wobbly, he needed help getting out of the tunnel to go in to get evaluated. There was some instability in that knee. So if they're needing help to walk and maneuver and they're not wanting to put full weight on it, that's when you need to take them to emergency room and get it checked. I tore my ACL when I was skiing, and after my lovely sled ride down where I knew something was up. It just really hurt a lot. And I couldn't roll over to get my skis off. The ski patrol had to help me get my skis off. Um, I knew I wasn't a good skier, so I was not going to be skiing down. At that time, I wasn't a good skier. And so I took the sled ride down. We went into the urgent care right there, and they took an X-ray. And they're like, "All right, nothing's fractured. Because if other common injuries, you can get a fracture, but we suspect that you might have an ACL injury." And this was at the time when MRIs were just starting to get out in the public and people were ordering them. So I didn't have an MRI at that time, but I went to I got my referral and went to ortho because in physical therapy, we know we're going to go to ortho, not necessarily primary care. Um, Insurance will depend on where you have to go first, but I went to ortho and he maneuvered my leg around. At this point, because I was in physical therapy, but worked in physical therapy, knew how to get the swelling down, get it to kind of calm down. I was on crutches, get into ortho pretty quickly. And he moves my leg around. He's like, "Yeah, you have an ACL injury. You're going to need surgery." I was 23 years old. Let's go. Um, so I didn't have to have an MRI. It's not always necessary to have an MRI. You can tell when there are things unstable, whether it be the ankle or the knee or the back, even if there's something that is like catastrophically wrong. Or not ACL. I don't consider it catastrophic. It is in the moment, but you recover, you get back, and you're back into life. It's a long recovery. But so if they come down, they hyperextend, they can't walk on their leg, get them checked. They may or may not need the MRI. They do them more regularly now, but you can tell if there's some laxity in there, that's an injury that needs time and recovery to get going. If it's a fracture, same thing. It's going to take time. Take this with a grain of salt. 6 to 8 weeks is normal healing time for for bones to repair, for tissue to calm down, for good scar tissue to come together and help things heal. That's normal. So we need to expect that time's going to heal. Now, someone that has a mild sprain doesn't necessarily need to be out for a whole 6 to 8 weeks, but they might need to lay low for a bit. They need to get their range of motion back. They need to be able to get their strength back and build other strengths so that they don't continue to roll and create a further injury. So the ankle sprains is a common one. People are like, "Oh, just sprained my ankle. I'm just going to get back into it." Patrick Mahomes had a bad ankle injury a couple years ago, and he got right back into it. I've been waiting for this ACL injury. And I don't mean to call him out. Like, I feel bad for him. He's, excellent quarterback, and he's done for a year now. Um, so, pay attention. Like, we want to rehab things to get them good and strong. I also not putting out hearsay there because I don't actually know if I think it was his left ankle. They were saying he was having problems with his left ankle throughout the game. So I think it was left ankle that was the injured one in the past. All right. So if they can't walk on it, they can't weight bear, and they're needing a lot of help, get them in to get assessed. And in those instances, so both concussion and suspicion of a potential fracture because they can't walk on it, it's really sore and they, or they're buckling, those are signs potentially that there might be a fracture, and that's something we want to stabilize and allow to heal. And if it's an ACL injury, same thing. If it's, Patrick ended up putting weight through his leg. I'm on a first name basis with him. I'm just kidding, of course, but so he's putting weight on his leg right away, but he wasn't really weight bearing through it, and he was leaning on people a lot. So that was definitely a sign that he needed something like, let's figure out what's going on and like make this happen. Um, the third the third thing that, should you go and get checked out is, you can't move a joint. So you're afraid to move it. So it really hurts when you move and it's like intense. So an ankle, it can even be an ankle sprain, like a pretty severe, mild ankle sprain. Usually they'll have a lot of pain, but they're not afraid to wiggle their toes, move your foot up and down. They may not want to twist their foot in because that's the direction generally that we sprain, but they can generally have a little bit of movement. You put that together with not being able to weight bear on it, that's a different story. Get them to the ER. But if they can wiggle their toes, they can move, and it's a little pain, but it's not terrible. I don't think that's a, go to the emergency room right away. But you keep an eye on it, and if they're not correcting how they're walking over the course of time, even this, I would say like 24 hours, like they may not be walking perfect, but they should be walking better. So if they're not walking better, then they need to go see an orthopedic. Um, in this instance, for an ankle sprain, they may not need the orthopedic. They could go to their primary care, and the primary care can do assessment, and then they can send them to PT. PT will do an assessment to make sure that there's no signs of fracture. They're going to tap on it. They're going to check the weight bearing. There are specific signs like this that we say, we can't treat you. You need to go get an x-ray. In the case of a primary care referring to PT, they've probably done all those tests, and PT can just get started and work our magic to get the range of motion back, to get the strength back, to get the tissue to calm down so that they get back and heal right away. And in these mild ankle sprains, they don't necessarily need to go to ortho. Something that's not progressing and is getting worse, that needs to go and see the ortho. If someone is having, you know, they hurt their knee and they can't bend it or straighten it, and they're just really afraid to move it at all, that's something, go get checked out. Could be a ligament, could be a fracture, could, on a worst case scenario, and it's very rare to see in a kid, is a patella tendon tear or a quad tendon tear. And what they, worst case scenario, they're just afraid to move it because they're afraid it's going to hurt. And then you go and they're like, you have patellofemoral symptoms and you need to go to physical therapy. And do some work to do some exercises to make it feel better. That's like, okay, we know nothing's going on and we can keep looking forward from this. I'm not saying patellofemoral symptoms are not really painful, but things like patellofemoral and Osgood ladders and severs for the heel, they're a little bit of overuse injury. They're usually biomechanically changes, and need to do exercise and need to correct movement so that and build strength so that they can move better, not have that same pull on the bone. And those don't necessarily, they usually are referred by ortho to me, but they can come from a primary care. And you really can, if your state has direct access like Massachusetts does, you can go directly to a physical therapist. We're trained to refer people out if it's not a movement problem. We treat movement problems by creating better movement. Hopefully your team has an access to an athletic trainer, and your athletic trainer can diagnose and refer you to the appropriate, whether it needs to be going to ortho or to physical therapy, or come in and just work in the training room to get things to calm down. I'm not one to say you should, I'm actually very opposed to always going and getting taped. Tape is, an athletic trainer can make an assessment on the field if something is broken and needs to sit out, or if something has maybe a sprain and not too bad, tape it up and stiffen it up so that they can get out and keep playing. They have the ability to do that, usually underneath a physician at the same time. But taping for a strain and like for wrists, I don't like people to go and get taped all the time because then you're not doing the work to get there. And most athletic trainers I work with don't do agree with me, and they don't like kids to come in and constantly get taped. So one off type of thing, but let's rehab it and get things stronger. So if they're having repetitive strain, and that's something that we're going to talk about in a second, but something that's acute, either athletic training is going to send them out, or if it's something that they're not quite telling their coaches and they come home, you might say, okay, they've got these strains and pains and it's kind of ongoing. Let's go get assessed, have a movement screen by a physical therapist, and they'll determine like, okay, yes, this is a physical therapy problem. No, it's not a physical therapy problem. Where do we go from here? And it can save you. Sometimes it's easier to get in, sometimes not always. It depends on a time of year to get in and see us and do that movement screen. I do movement screens for cheerleaders, and I do them online. And to tell you, you're this is something you need to go get checked out for, or you know, you can either do physical therapy or just try this exercise, and you'll be fine. Um, let's see. So we've talked about concussions. We've talked about not being able to walk on it, not being able to move, and so those three are key things to be able to require you to really go. In conjunction with that, if you can't really touch it, so with a fracture, a tapping on the bone is one indicator that there could be a fracture there. And if so, they can't tolerate tapping on that bone, that's something you need to go and get that checked out. And that goes along, again, they likely aren't going to stand on it. They likely aren't going to want to move it. And those are all signs of fracture and absolutely need to go. So we talked a little about those like chronic strains like Seavers and Osgood-Schlatters and IT band and patellofemoral symptoms. Same goes for wrist tendonitis. If they can move, but it hurts, and it hurts when they're stunting, or it's fine when they're sitting around and sleeping. If they might wake up and be like, Mom, I'm still sore from last night, but they can move their joints. And you look and see how they move. So if it's at their knee, you might see, can they touch their toes? Can they do a squat? Even if it causes pain, they can do it and it doesn't look scary and they're not scared to move. There's likely not anything that a physician is going to do. They're going to send them to physical therapy, and that they're going to work on getting things stronger at that point. So again, you can go straight to physical therapy for those type of things. You don't need to go have the x-rays. If something's not improving, we're going to send you out to get x-rays and get further assessment. It may be a matter of you just have to keep, the x-rays, 9 times out of 10, the x-rays, I send somebody to be overly cautious because I want to make sure that nothing's going on. It's very rare that I have somebody that comes back and is like, yes, glad I went because I had this massive fracture there. Those people have already gone to the just to get worked up, but when I send someone, it's really just to rule it out, make sure there's no DVT. Again, there's clinical prediction rules that say these things, if they have X, Y, and Z, you need to go get checked out, get on the appropriate medication, then we can continue. But the overuse and the strains, those are physical therapy treating dysfunctions, pain. And so those tend to be, I know a lot of parents will be aware of those because the kids want to stop doing things and they complain a lot. When they come home from practice and they're like, oh, my back is really sore. I didn't stop doing what I was doing in practice, but my back was really painful and it's more sore now. Or, my knee, it doesn't hurt as I'm doing something, but when I finish, it's really sore and painful. And I don't want to, and they're asking for Advil all the time, or they're having to ice all the time. That's something that should get checked out. But again, that can go directly to PT. Um, I'm a physical therapist, so I refer to PT. I think there are a lot of incredibly amazing, smart, very qualified chiropractors. I would recommend a sports chiropractor as opposed to a network chiropractor in this instance, because they're going to look and see how you move and not just look at x-rays and say, oh, we need to adjust. We do adjustments too. We call them mobilizations and manipulations. But I don't agree that somebody needs to be going 3 times a week for 4 weeks, and then 2 times a week for 4 weeks, and then 1 time a week for the rest of their life. Like, I think, like, let's figure out what's going on. Maybe you need to be in there 3 times a week as you're starting to get things moving and get things, uh, feeling better, calming down that tissue, and then progressing to exercise, and most kids' injuries will heal and feel better without the repetitive strain when they're at rest. Oh, no, sorry, that's a separate. When they take a pause from the activity. So if they take a week off, most things will quiet down. And then you still have to work on correcting what caused that in the first place. If it's an injury and that's a fall, that's a different story. If it's repetitive over time and they are out practice 3 days a week for 2 hours a time and they are going hardcore, then doing privates, that's an overuse. And usually when we take a break from that, things will calm down. Now, you don't get a break because the year goes all the way around. There's not a whole lot of time for outside strength training to help prevent those overuse injuries. Um, it's a struggle. And I'm not saying they have to stop, but sometimes taking a little break, maybe if it hurts with working on fulls, but it's okay working on tucks, maybe they don't work the fulls. Or if, they can do front tumbling, but not back tumbling, they work front tumbling until they feel better, until they're getting the mechanics of that feeling better. So just because there's pain doesn't always mean they have to stop, but sometimes resting and changing how we're doing it can make a big difference in how we perform long term. Um, if the pain is not coming down with rest, then they should go get further workup. If they are, not getting better with physical therapy, so sometimes it depends on the injury. If a kid's growing, they might need to get seen a little bit longer. If they had an acute injury, if it's an ACL, they're going to be in physical therapy for 9 months to a year pretty regularly. If it's an ankle sprain, they're probably going to be in PT for 4 to 12 weeks, ramping up over time. Doesn't mean they're out for that long. It just means they have to ramp up and build up. But they should be making progress in there. If they're not making progress, if they're not like seeing a change in like 4 to 8 sessions, then they might need to go get further workup. It doesn't mean that it set them back. Sometimes with an ACL injury, you can't tell. Like for me, mine was pretty loose, and the doctor's like, "Oh, yeah, gotta go." But I've seen people like I can't move their knee, but their knee is like massively swollen. Swelling comes down, pain's coming down, but I can wiggle that knee pretty good. Then I'm going to have them go back. And that wasn't wasted time in therapy because we got the swelling down. We got the motion back. We started to get the muscles contracting. Now they're in good shape to go have whatever surgery they need to have. Um, So trust your physical therapist. If you don't have a physical therapist in your phone system, I encourage you to find one, and find somebody who's not just tied to the insurance system, because goodness knows that's just going and gonna be. I had a friend today comment that she got payment taken out and it was $1,000 out of one paycheck prior to her expecting it. Um, it's a big chunk of money. And so insurance, it's not my soapbox for insurance, but I understand, those rising costs can be challenging. but find somebody that will talk with you. Maybe there are group programs that your kids can do to help get them moving more. Maybe they can do, once a week or every other week, and they have to focus more at home. So there's a lot of options out there. And if you don't know people in your area and you need someone, please message me because I know people around the country, specifically. I know people in other countries as well, but in the States, we have networks that we can find people in. So, have a physical therapist you can call and contact, and that doesn't mean you have to be seeing them on a regular basis, but that you can go in and get an assessment like, do I need to have further workup for this? Or, can we do some physical therapy and keep moving forward? So those are the 5 tips: consciousness, not being able to walk on it, not being able to move it, not being able to touch it, and the chronic ones that are not getting better with either rest or physical therapy, and in that 4 to 8 week session. Rest, if they take a week off and they feel better, but then they go back into doing the same activity and it comes back, that means it's an overuse and they need to do some work to correct it. And they if it's repetitive in the back, that kind of thing, if it's hurting when they're tumbling, I might say, yeah, let's go check and make sure you don't have a spondylolisthesis, um, just, and a pars fracture, just to make sure, because that doesn't mean that you have to stop, but it does mean we have to do some different work on getting your motion better so you don't keep pounding that. Um, and if that progresses, that can lead to nerve pain and it's not fun. So we want to build up and get the stability as much as we can. If you have questions about any of this, I'm happy to answer them. You can reach me on socials or you can email me, laura@movebetterllc.com. Um, I do dive into some of this in my book. So there's more information in the Strength and Conditioning for Cheer Athletes book. So go check that out. I have an offer in the link tree down below where you get lots of different extras in there, as well as you can also get it on Amazon. So, and there's links to different exercises, to help get things strong. Because I know it's really hard to actually get to physical therapy or get to the gym when you are trying to get to all of your cheer practices and do all the extras at cheer. And now, we're getting into January. It's just going to be a little bit more chaotic on a practice schedule wise. And over the next 2 weeks, it's not going to be chaotic with holidays. But, you know, keep your kids moving healthy. If something feels good, this is something I tell all my clients, and I hope this is a good takeaway for you. If something feels good, do more of it. That's good. If it's not feeling good and it's getting progressively worse, then get it checked out. 1, stop the activity, and 2, go get it checked out. I think the biggest thing you can teach your kids is start to feel what they feel in their body. Are they feeling it where they're supposed to? And does it feel nice? Because movement should feel nice. Stretching, mobility, it all should feel nice. Yes, we get that nice muscle soreness when we work too hard, but that's in the muscles and not, not ouch pain. If it's ouch pain and it's not going away, go get checked out. Hopefully that clears some up. It's always work in progress, and I understand that, and every person is different. So get the information online, talk to your friends, because having a community to support you is very important. But also recognize that it's a community, and what was good for Sally may not be good for Sam. And it all depends, and we're not looking at you in real time, so we need to assess you in real time. I think that's all my ramble for the week. Thank you so much for joining me. Have a great week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. And as my friend Drew Kelleher said, you're responsible for your own vibes. Let's go get the day.